The healthcare systems in the UK and the USA differ significantly in terms of structure, funding, access, and quality. The UK operates under the National Health Service, a publicly funded healthcare system. Healthcare is free at the point of use for all residents, funded through general taxation. The NHS provides comprehensive care, including primary care, hospital services, mental health services, and emergency care. Private healthcare exists but is used by a minority of the population. In contrast, the USA has a mixed public-private healthcare system. Healthcare is primarily funded through private insurance, employer-sponsored plans, and government programs like Medicare for seniors and Medicaid for low-income individuals. There is no universal healthcare system, and access to care depends on insurance coverage. Private hospitals and clinics dominate the system, with some public hospitals serving uninsured or low-income patients. Access to care in the UK is universal for all residents, but there are long waiting times for non-emergency procedures and specialist consultations due to high demand and limited resources. Primary care is usually the first point of contact, with patients referred to specialists by general practitioners. In the USA, access to care is tied to insurance coverage, and uninsured individuals may face significant barriers. While there are shorter waiting times for elective procedures compared to the UK, costs can be prohibitive. Patients can directly access specialists without referrals, depending on their insurance plan. Regarding the quality of care, the NHS is known for providing high-quality care, especially in emergency and primary care. However, resource constraints and underfunding can lead to variability in service quality. The UK performs well in preventive care and public health initiatives. The USA is recognized for cutting-edge medical technology, advanced treatments, and world-class research facilities. While the quality of care is generally high, disparities exist based on insurance coverage and socio-economic status. The USA spends more on healthcare than any other country, but has poorer health outcomes in areas like life expectancy and infant mortality compared to other developed nations. When it comes to the cost of healthcare, the UK offers free healthcare at the point of use, funded by taxes, with prescription medication subsidized and a small fee in England. In contrast, healthcare costs in the USA are the highest in the world, with significant out-of-pocket expenses for patients, even with insurance. Prescription drug prices are much higher compared to the UK, and medical debt is a significant issue for many Americans. In terms of medical facilities, NHS hospitals and clinics are the primary providers of care in the UK. Facilities are generally well equipped but may face overcrowding and resource limitations. Private hospitals offer faster access and more personalized care but are expensive. The USA has a range of medical facilities from small private clinics to large, state-of-the-art hospitals. Many hospitals are affiliated with academic institutions and are leaders in medical research and innovation, although rural areas may have fewer facilities, leading to disparities in access. Patient experience in the UK generally reports high satisfaction with the NHS, particularly for emergency and primary care, though complaints often focus on long waiting times and limited choice of providers. In the USA, patients with good insurance coverage often report high satisfaction with the quality and speed of care, while uninsured or underinsured patients may face financial stress and limited access. The strengths of the UK system include universal access to care, lower overall healthcare costs, and a strong focus on public health and preventive care. However, weaknesses include long waiting times for certain treatments and resource constraints. The USA's strengths lie in advanced medical technology and innovation, shorter waiting times for elective procedures, and high-quality care for those with good insurance. Conversely, weaknesses include high costs, lack of universal coverage, disparities in access and outcomes, and medical debt. In conclusion, the UK and USA healthcare systems have distinct strengths and weaknesses. The UK's NHS provides universal access but faces challenges with waiting times and funding. The USA offers high-quality, innovative care but struggles with high costs and unequal access. The choice between the two systems often depends on individual priorities, such as affordability, access, and quality of care.